Welcome to the show. Today's guest is Carlyle, Jansen, and we're going to talk to her about the almighty female orgasm. You don't want to miss the show. We'll be right back. Hi, welcome to the show, and my guest today, Carlyle Jansen, founder of Good For Her in Toronto, and topic of the day, huge one, orgasms. Welcome to the show, Carlyle, and female orgasms. We're just going to kind of focus on the female orgasm,
okay,
because that's just a huge energy that just needs to be lifted and blended and come back into the world again, because it's been all about male orgasms for centuries. Why is it important for women to have orgasms, or to try to achieve, to get on the path to experiencing orgasms?
Well, our sexuality is part of what makes us whole. Our sexuality is part of our lives, and so exploring that and enjoying it and expressing it is important, whether you're partnered or not. On a physiological level, it's also really important to have blood flow going down to our genitals. Having orgasm strengthens our pelvic floor, which is important for urinary continence, so that you don't pee a little bit when you sneeze.
Right.
And it also prevents medical problems when you're older, such as your bladder falling through the front vaginal wall, which is quite painful and often requires surgery.
Yikes.
Yeah.
So, do all women have orgasms? I mean, are we capable of having orgasms?
I think most women are capable of having orgasms. I think there are a lot of women who are trying to have them, who can't, but with some education, with some information, with some confidence, with some permission,
right,
to make noise, to feel pleasure, to ask for what they want. A lot of women that I teach in my workshops email me afterwards and say, "Oh, I finally had an orgasm."
Wow. Orgasms we've been stifled from them. We've been blocked for centuries. I mean, most women in the old times where they were hysterical and they started just ripping out the inner organs of our reproductive area because we're hysterical women, because we're under-orgasmed.
Well, or because we expressed emotions.
That's why I think a lot of women, well, back in the days of when they were giving hysterectomies just for that reason, is basically, I think, frustrated and needed to have that energy released through orgasm. I mean, that's pretty tragic.
Yeah, I mean, we were suppressed in lots of different ways, right? We didn't have a voice in the home. We didn't have choice about whether we had kids or not, or whether we worked or not. And our sexuality being stifled was just one of those many things.
Do most women experience orgasms, and then is it just a sort of a sensation in the genitals, or what different levels of orgasms are there?
I mean, everybody experiences it differently, and it's, I can't get inside your body
right.
to know what it feels like for you. So we have descriptions is the best way to sort of assess what's going on. But I mean, some people have very localized orgasms where they feel it just in their clitoris, and that's sort of where the pleasure is. For some, it seems to like extend to their fingertips and their toes and in their minds and everywhere, and it feels like the whole world is on fire.
Right.
And there's lots of degrees in between, and some people have lots of different kinds, and some people just have one.
Right. What kind of ailments in your body, like if you have physical ailments, would an orgasm help alleviate some of those pains, other pains in your body? Like, I mean, for relaxation purposes.
Well, yeah, orgasm and sex are pleasurable activities. So anything that is helped by reducing stress will be helped that way. But certainly lots of people use orgasm as a way of dealing with menstrual cramps,
right,
alleviating any kind of pain such as headaches. And there have been studies that have looked at how pleasure and orgasm are ways of reducing those kinds of painful experiences.
Right.
And I think it also, just as an overall general health, makes you feel connected to the world, to a partner if you have one, and feel confident and in charge and powerful.
Yeah. If you haven't had an orgasm, let's say you're working with a woman who has never experienced an orgasm, what's the best way to really sort of delicately approach and have her experience an orgasm? Where would you start?
Lots of places to start. I mean, one is does she know her anatomy?
Right.
Like so many women expect that it's going to happen through intercourse.
Right.
And it happens that way for some women, but lots of us, we need clitoral stimulation to get there.
Right.
And then lots of people will tell me I don't orgasm, and then I realize that they orgasm, but they orgasm from clitoral stimulation, and somehow that doesn't count.
Yeah.
I mean, an orgasm is an orgasm, and some feel different than others.
Right.
So helping her understand where her erogenous zones, and everyone is different.
There's 9 anatomies to that beautiful little blossom down there.
Yeah, and so lots of women, you know, they read what they see in Cosmo or what their friends tell them, and that might not be what works for them.
Right.
So they need to explore, they need to know about their bodies, and they have to feel like it's okay to let go.
Yeah.
And encouraging women to, that it's okay to take the time, that it's okay to feel the pleasure. It's okay to say, you know, on the left there is not really working, or can you go a little more gently?
Yeah.
Because so many of us feel like we can't ask for that.
Yes.
That it's okay sometimes to use a vibrator.
Well, that was my next question. Do you encourage women to use some kind of external prop so that they can explore on their own, just to get to know their erogenous zones?
Well, exploring on your own is always a great first step.
First step,
Knowing your body, whether it be your own hands, whether you use a toy, whatever you want to use, is a great way to figure out what works for you. And lots of women can orgasm on their own, but not with a partner.
Right.
So that's the place to start.
Right.
Using a toy, for some people, is the only way to get there.
Right.
For me, I tried all kinds of things for years, and when I finally got a vibrator, then I finally was able to have an orgasm.
Wow.
And some people just need that kind of power.
Yep.
Just like some people need glasses in order to see, some people need a calculator if they're going to do math.
Right.
Some people need a vibrator to orgasm, and there's no shame in it.
You have to explore. I mean, that's a hidden place down there. We can't see it,
It's hard
you know,
to see.
and you don't understand until you actually feel the pleasure. My first orgasm, I was 35 years old, you know, in the bathtub.
Right.
Just, you know, exploring away because it was relaxing, and I'm like, what the heck is this?
Yeah.
What's going on there? And then you start to really realize how pleasurable it is, and then you crave it and you want more of it, and you realize the stress that is alleviated from having them. Then you can teach your partner what you like.
Yes.
Some men don't really like to have somebody show them. It's an ego thing. It's like, I did that with you before, and you know, you seem to like it, but then if you've explored on your own and you like this other thing now, and then you show him, it's like a, you know, I mean, do you find most men are willing to be guided?
It all depends. I mean, the people who really genuinely want their own partner's pleasure, and it's not about them, it's not about their ego, it's like, I want you to have pleasure, tell me what I need to do.
Right.
And lots of men are like, what do you want me to do? You want me to use toys? You want me to go down on you? You want me to do it upside down?
Right.
What do I need to do? And some, I think, have fallen into the belief that I give you an orgasm.
Yes.
And it's about my virility, my being a good lover, that's what brings you the orgasm, and that's just not true.
We're responsible for our own orgasms. We have to own it. We have to be able to honor it and to explore it, and then just power it. And then that way it's ours, and it's not it's not anybody else's, and each orgasm, and each one is different,
But I think
intensity wise.
Yes. And I think the key also is to understand that sometimes we have to learn some of these skills.
Yeah.
Because I think we have this idea of sex is this natural thing that happened. It started in the Garden of Eden, and everything was beautiful, and we kissed, and we had sex, and we had orgasms, and we lived forever, and we danced into the sunset. And most relationships just are not that way.
It's kind of mythy, isn't it? Yeah.
It's a little bit simplistic, and so people feel like sex is supposed to be natural. I'm just supposed to know what you like, or I'm just supposed to know what works for me.
Right.
And sex is a skill like many other skills that we learn in life, and it's okay to learn about it, to ask questions, to figure out what works for you. To not know and seek answers is okay, whether it be about your own body or your partner's body, is totally legitimate, and I think a very laudable, fabulous endeavor.
Right. This thing that men are fixated with, they have a fixation about women squirting. So, I mean, I don't know if I do. I don't think I do, but I think some men want their partners to squirt. I mean, is that possible? Do all women squirt?
Well,
I
so
mean,
most women, I think, squirt, but not all of us squirt outwardly.
okay.
So women who ejaculate or squirt, you will see either a dribble or a stream that comes out of the urethra. It doesn't come out the vagina.
Right.
And it's not urine. It has a different chemical composition than urine does. And it comes from a gland, the female prostate, around the urethra.
Okay.
So some women squirt that out, and lots of us, we're a little nervous because we hold it in. We don't want to pee on our partners. Where's it going to go? It goes up into the bladder.
Right.
And then we're finished having sex, and we say, excuse me, I need to get up and go pee. What we're peeing out is ejaculate.
Right.
And the theory is that ejaculate is nature's way of preventing urinary tract infections or bladder infections.
Interesting.
Because we've all heard, if you've ever had a urinary tract infection, you know you're supposed to pee after you have sex.
Exactly.
Right? We need to produce that water from somewhere. So the body naturally ejaculates or produces the fluid that goes in that then we pee out so that we have some fluid to keep us from getting infections, which, you know, without modern medicine would kill us.
Well, on that note, we got to dig deeper into this deep, dark secret of orgasms. And we'll come back for a second half right after the break.
Okay.
We'll be right back. Welcome back to the next half of orgasms and the talking orgasm, squirting orgasm. So we need to know a little bit more, Carlyle, about this technique or how we can apply pressure. What kind of pressure is involved with this whole, you know, technique of squirting or ejaculating through the urethra? Yeah, explain, go.
So ejaculation is something that lots of us do, not all of us do.
Right.
My guess is about 15% of women naturally ejaculate outwards.
Okay.
Part of the problem now is I get all kinds of women coming to me like, my boyfriend wants me to squirt, how do I squirt? And
God.
it's now this pressure that, you know, not only do we have to have good careers and we always have to look sexy and we have to be a good cook and a good parent and orgasm, you know, in the right way and saying the right thing at the right time, and now we have to squirt at the same time.
God.
It's a lot of pressure.
That's because they do. They want us to.
Well, it's a performance thing, right? And this, again, this idea that I'm a good lover if you squirt.
Yeah.
You can be an amazing lover and your partner doesn't even orgasm,
right,
let alone squirt,
yeah,
right? It's not a correlated item. And so squirting is something that can be learned and often requires stimulation of the G-spot. So that's inside the vagina, usually with 2 fingers, this come here motion. And one of the mistakes that people make about G-spot play is they're often going in too deep.
Yes.
And so sometimes I say it's even just the first knuckle in.
Right.
Try with depth and shallowness.
Right.
You have to be aroused first, so don't sort of like just go in there when somebody's sort of lying down.
Like,
say,
hello.
Like, hey, is this going to work? So we have to be aroused and have blood flow. And some of us need a fair bit of pressure.
Yeah.
Some people are surprised at how much pressure we need. And so you have to really spend some time in what's called milking the prostate.
Okay.
And milking the G-spot. So stimulating it that way will often work. Not for everybody.
Now, do you have to stimulate the clitoris at the same time when you have your...
You can. And most people, they will feel sort of this buildup and this urge, and then you pull out either your fingers or a toy or a penis outside and then stimulate the urethra on the outside and push.
Jeez.
And that's often what will do it. That a lot of people who squirt, they like the sensation on the inside, but then you need to pull out in order to actually squirt.
Okay. So do we all have orgasms when we're having intercourse? I mean, is that a possible thing, or I do?
Great. Well, the statistics are that about 30% of women do.
And I find that if I don't, then I'm not satisfied. It's got to be really, I guess we're all designed differently in there.
We're all designed differently. I mean, unfortunately, there's a lot of cultural pressure that we're not supposed to feel satisfied unless we orgasm during intercourse.
Right.
Lots of us, all we need to do during intercourse is reach a hand down on our clit, or our partner can do that,
Yep.
put a vibrator there, just add that into whatever's going on, we'll do the trick. Or you just, you know, have your orgasm first.
So what's the difference between the clitoral and the vaginal orgasm?
They're all a bit different. The theory is that different nerves are involved. So some nerves are involved in the clitoral orgasm, some are involved with more deep vaginal orgasms. Some people say it's those same deeper ones that are activated from the G-spot, and some people say it's a combination of the two when the G-spot is stimulated.
Interesting. What about, this is just kind of like, it might be a little gross for some people, but the anal area, on the exterior of the anal area, when the whole cavity, like, I mean, that's a huge erogenous area from, you know, the pelvic bone all the way around to the, you know, the perineum and all of that anal area.
There's lots of nerve endings there.
Rock it all together.
There's lots of nerve endings. If you're comfortable with anal play, some people orgasm from anal play.
They do.
Some people like just the external part stimulated during other kinds of play.
Right.
Obviously, if it hurts because you're not doing it in a way that works the best for you, you know, you're not going to enjoy it.
Right.
But if you go slowly enough, use enough lube, take your time, and do what feels good, that can certainly intensify the pleasure and help people to kind of get over that hump in order to have an orgasm.
Yeah, the lube's a big one. I mean, you have to be wet down there. I mean, and I think it's the sensation will even relax the yoni even more when it's wet. That's why I think when I was experimenting, when I was in the tub, everything was all wet and juicy down there, and it was just warm and, you know, unfrozen.
Right. Yeah, I mean,
warm up the lube.
Lubrication is really key. And if you're breastfeeding, if you're in menopause or post-menopause, if you're stressed out, if you've had a lot of alcohol, if you're on certain medications, that will dry out your natural lubrication.
Right.
Doesn't mean you're not attracted to your partner.
Right.
Doesn't mean that your partner's not doing a great job. It just means you need to add some lube.
Yeah,
and
you have
a good quality, long-lasting lube will just make everything feel better, for whether it be stimulating the clitoris, the labia, the vagina, or the anus, if you like.
What's the best place to start when you're actually wanting to stimulate? In a man's perspective, like if he has to learn all over again to reapproach the female genitals, where should he start?
With her mind.
With her mind. I know that, but if
and
you get past the mind.
The whole body, and you know, we can tell when you're like going here because you really want to be here, and when you're here because you really want to go there. Be present in the moment.
Yep.
And then start with like the inner thighs and the lower abdomen and stimulate the labia and between the labia and all of that luscious area that has tons of nerve endings and feels great.
So why are they always going for the jugular all the time? I mean, they think that that's where the primary stimulation starts.
So some people haven't learned that women need a lot of warm-up. We need a lot of time to get there. We need to often get aroused before we'll even feel horny. And we have to kind of get that pump going a little bit. And I think sometimes when you've got an erection and you're afraid, like, oh my God, if I don't do something with it now, I'm going to lose it.
I know.
And so this sense of urgency happens where you think, okay, I have to do it now. As opposed to, you know what, your erection might go and then it'll come back again.
Yeah.
And then there's time.
Right. And for orgasms, when we're talking about energy and harnessing it and just prolonging that sensation a little bit, I want to just get into a little dialogue about that. Is it okay to hold off the orgasm and just learn to be present with the feeling?
Absolutely.
Of being just really aroused down there and pulling back to center a little bit, just to see what you're actually experiencing. If you're exploring an orgasm for the first time and then you feel like you're going to come, so what are some exercises you can do to stop it so that you can really weave it and have it move through your body a little bit more so that you can really empower that whole energy?
Well, I mean, anything you want to do with your body that feels good is great. So if you want to have the orgasm, great. If you want to hold back and just harness it, that's great. If you want to try and have multiples, that's great.
Can we have multiples?
Lots of women can. Lots of women can.
Can we learn how?
Yep.
I've learned how just recently. I mean, I've realized that now I do want them.
Right.
More of them.
I mean, I teach a workshop on orgasms, and I just actually wrote a book called Sex Yourself.
Cool.
That is all about pleasure and your body for women and orgasms, and we talk about multiple orgasms in there. But my theory about multiple orgasms is that generally, you know, when you hit an orgasm, especially from clitoral stimulation, and you get to that peak, and then you're like, okay, don't touch me anymore, right? Because you're hypersensitive.
Oh yeah, vibrating.
So then, the arousal goes too far down, and it's hard to bring it back up again.
Okay.
So what I recommend is when you're on that peak, rather than stopping touch entirely, go back to that area around the labia, the area called the vestibular bulbs between the inner and the outer lips, and stimulate there, and then you'll keep the arousal high, and then you can build back up again.
Do you know about the heart center in the vagina and the whole makeup of the yoni? There's a little heart center on the upper quadrant, the upper left quadrant.
There's many theories about.
You know that one? Do you know that one?
I don't know that one.
Oh, that's an interesting one that I've just discovered, and I've done some research, and that when women self-pleasure themselves, immediately they go right to the left side of the upper quadrant, which is a place just to circulate. And it's like the heart centers. We have chakras in our bodies. That's our heart chakra in our vagina. It's kind of interesting. I go there all the time.
Great. So that's a good spot to explore.
Yeah.
It might work for some people.
Yeah, and everyone's different. So this is the thing. We have to take the time. We have to learn our orgasms, identify it, name it, whatever you want, you know, and just play with it and learn and grow with it. And they change over time.
They do. And as we age, after childbirth, when you're stressed, when things shift in the relationship even, whether you're doing it solo or with a partner, all of those things affect our orgasms, how much we feel, where we feel it, how powerful they are.
Right.
But the energy is always great, and I even sometimes use it as a way of, like, if I'm feeling sad but I can't cry, or I'm feeling stuck, the orgasm, it's like a cleaning.
Oh, totally cleaning.
It just cleans everything out and just like, whoosh, okay, can move on.
I find I concentrate better after an orgasm. Like if I'm reading or if I've been stuck on the computer or something, and it's just time to get into self-pleasure and just go, and it's usually not very long, but it's like the real quick, the immediate release. Yeah. And then my mind is clear. Right. I mean, the orgasms are so mysterious. And there's so much to still discover about the female orgasm. It's just amazing.
Well, and sometimes we think when we've had, 100 or 1,000 of them, like, we know what it's all about.
No,
but there is always more to learn. There's more erogenous zones, because sometimes what you tried 10 years ago, you go back to it and, oh, now it actually works.
Yeah.
It feels better.
I know.
Or we can learn different ways to orgasm. We can express our pleasure in different ways. We can intensify it by making sounds.
Sound is really important to harness it. Just the gateway to, once it is coming up to the throat, it's so important to really let it out through the throat so that you can have that orgasmic sensation right up in the top of the head. That's where you need it to go, so the whole body's flowing after. Orgasm talk. It was good having you on the show, and I've got to get that book that you wrote. I didn't know that you wrote that one.
My first one. It's just out.
I will be getting it and read that one and get some more information that I need to have. We'll be right back. Thanks for watching the show today. It was awesome having Carlyle Jansen on, talking about the almighty female orgasm, the mysterious energy of the female orgasm. If you have any questions on this topic, feel free to give me an email directly at sexwithdrzen@gmail.com. We'll see you soon.